by the EGROW Foundation. As you know, that EGROW Foundation is a research-based policy advisory body, and we believe in research-based recommendations. In the last 2 years, taking advantage of COVID, we have started this webinar series, which is on contemporary issues. We have been very fortunate in this webinar series. We have had policy makers from across the world speak to us. We have tried to maintain a balance of 50-50, 50 speakers from outside the country and 50% of the speakers from within the country. We have been fortunate to have 2 Nobel laureates come and speak to us, and we have had professors from the best universities in the world to speak to us. Within our country, we have been very fortunate to have policymakers and academicians speak to us. It is in this very context that we are now celebrating the 75th year of our independence. The Prime Minister has been extensively talking about this very year. Many reforms have been undertaken in the last few years. To address this issue of reforms, we have run a special series starting from Professor Panagaria. We had Dr. Arvind Vermani speak to us about the reforms which he gave the details, as he mentioned, from the trenches. Continuing with the same trend, we have again invited Dr. Arvind Vermani today to speak to us on the Indian welfare system, vision and evolution, because he was closely associated with these issues when he was in the Planning Commission, as well as when he was in the Ministry of Finance. In continuation of the same theme, next week we have Mr. Monte Kaluwalia also speak to us about reforms. With this, we will be then providing a glimpse into reforms that had occurred in 1991. Let me introduce the main speaker for today, Dr. Arvind Vermani. Dr. Arvind Vermani is also the chairman of EGROW Foundation. He was earlier the Chief Economic Advisor, Government of India, Ministry of Finance, as well as the Executive Director at the International Monetary Fund, representing India and other countries. Dr. Virmani himself is a rock-solid researcher. He has published extensively in peer-reviewed journals, and he has books to his credit. He has been in the thick of policy making from 1987 onwards, and before that to some extent even at the World Bank. But from 1987 onwards, when he joined the Planning Commission and the Ministry of Finance, he has been in the thick of policy making. And major issues that have come up in India, there are routes and notes which he mentioned last time, which he wrote while he was in the trenches. From 1987 to 2009, he has been extensively involved in both the Planning Commission and Ministry of Finance to formulate and provide inputs on various policy issues. Today, his focus is on the welfare schemes. He has been closely associated with the UID, which is the forerunner to Aadhaar. And with this brief introduction, we invite him to deliver his talk. Dr. Arvind Vermani, please.
Thank you, Dr. Sharan Singh. Let me start the thing. Okay, can you see that? Is that visible?
No.
Slides?
No, slides are yet not visible.
Okay, it's come here. Let me see. There must be a share. Oh, we always need Vivek for this.
Vivek is around to help you. Vivek, can you please help?
Let's see where the share is. It's come on my screen, but I have to find the share. More slideshow option. Help and show. 1 second. Display settings.
Professor, Virmani level வேற ஆயிடுச்சு professor. Professor, அதாவது
Wait, where is the share? Shucks.
Ama. Yeah.
First the share. Okay, hold on. Let me, before I start the screen, maybe the share comes first. Okay, here we are. Share. Okay, here we are. Right. So this is the share. Is that sharing?
Yes, we can see it now.
Now we can see. Yes.
Okay, so let me do the slideshow start, then hopefully you just see the slides. Is that coming?
Yes, we can see the slides.
The main slide, right?
No,
Yes,
but
yes.
you'll have to probably come down and click on the slideshow because we still can see lots of slides on the left side.
Okay, so slideshow. Yeah, here we are. Okay.
Yes.
Now it's okay?
Yes, perfect.
Okay. Okay, thank you. Sorry for that. It's always a little bit of a issue starting the thing. Okay, so thank you for introduction, Charan. So let me wade straight into it because there are a lot of slides. Now the introduction. You can see the introduction slide.
Yes, we can.
Okay, so growth in per capita income is the driver of poverty reduction. But most social indicators are strongly correlated to the per capita GDP and its growth. So growth is critical, but we also realize that the benefits of growth may not percolate equally to everybody in the country. We have a huge country. There are now 1.4 billion people. Now actually in 2022 June, the biggest, most populated country in the world. So growth is critical but may not benefit equally. So government must ensure equality of opportunity, and also some groups are chronically disadvantaged. So society must support that. So we have to have a safety net or a social welfare system is needed. So in this talk, I'm not really going to talk about growth and other things, but focus on what may be called Atmanirbhar social welfare. In the headline of the talk, I said Indian version, but you could also call it Atmanirbhar social welfare system. So in India, there's always been a focus on poverty reduction, and the two major modalities. Again, I'm abstracting to give a sharp and clear picture. There are all kinds of other aspects which we can discuss in the Q&A. So two major modalities have always been the food and public distribution system and the poverty alleviation programs. And we'll say a little more about that. But the major issue with food distribution has been inefficiency and distortions. And overall, in all these poverty programs or anti-poverty programs, the issue of leakages, corruptions, and inefficiency. We'll come back to that. It was famously said by a politician, I don't want to name names, that only 15% of what is spent reaches the poor. So this have ranged, the leakages taken together and inefficiency have ranged from 75 to 85%. So that's a major issue which has confronted me as an economist dealing with these issues. So let us look very quickly at the poverty rate in the next slide. So here we have from Dutt et al. From the World Bank, a graph of poverty rate, the head count ratio. The middle line, this green, this little line in the middle is the overall poverty. The red is urban and rural. Just focus on the middle line if you can. So the interesting, two or three interesting points here which I want to point out. That look at this this is the period of what I call bureaucratic socialism from about 1950 to 1980. And you see that over this period, the trend, if you draw a trend line here, poverty actually increased. But of course, what happened was it went down initially after independence and then shot back up again. But the trend was upwards. So rise in the poverty in the 1960s, which gave rise to this slogan of Garibi Hatao. So it was probably India was probably the first country in the world to talk about Garibi Hatao, or poverty. And the general name given in English was poverty alleviation program. There were a host of anti-poverty programs. So, and one of the reasons is the thinking at that time is very important to understand. They thought, oh, we've done all these great things with socialism, etc. We are doing everything for the poor, yet poverty is going up. Very strange to them. Okay, our analysis will come as we go through the whole picture. So they thought, oh, they were scared. They said, despite whatever little growth we've got, poverty has actually gone up at the end of the period. What is happening? So we need to have poverty alleviation. That is the origin of this Garibi Hatao, etc. So then from that, some people, among which was yours truly, we realized that the per capita growth, and there are papers on this, I won't go into the details because that's not the main focus, that we needed reforms, that per capita GDP growth has actually gone down, and that's a big driver of poverty reduction. So in 1980 reforms, you see the 1980s reforms will about here, and you get a sharp reduction in poverty. So it's very sharp. The growth rate also very sharp, and people wonder, many other experts which you hear and have heard about don't give credence to this 1980s reforms, which we talked about in our last talk, which Dr. Charan Singh mentioned. But it was like a pressure cooker. The pressure cooker was released, and suddenly growth started rising, poverty started declining. And in 1990s, you see here, somewhere here, you can see this arrow of mine here, you actually have a little bit of a lag. You have these reforms, but poverty is still fluctuating. It's not going down dramatically, okay? And this again, we have a paper called the J curve of productivity, which is an IMF paper, which you can read if you're interested in that. But then you have a sustained increase in growth and a sustained decline in poverty. So this is basically all I'm going to say about growth and poverty. So that linkage is very clear. We've discussed it in earlier talks, and maybe we'll come back to it again, but that is not the focus of this current talk. So we want to now talk about the poverty. So conceptual change, what after looking at all these things, the things I mentioned in the earlier thing, one made a conceptual change. One said that, you had these poverty alleviation programs when I was sitting in 87, which is the start of my term in Planning Commission. What the heck is going on? Started thinking 87, and I came to the conclusion that poverty could actually be eliminated. Why? Because of all these inefficiencies, But of course, one element of that, the programs were very general. Nobody knew who exactly the people were. They just focused on those numbers. Remember the graph? 60% are poor. There were so many poor that basically nobody bothered the individual who is getting, who is not getting, what they are getting, but just reduce poverty, all the poor will benefit kind of approach. So to eliminate it, you have to make sure that every single person gets it. And that was the thinking, and then led to a whole lot of other things which we will discuss. So the elimination of leakages and corruption was a strong driver, and the inefficiency and distortion, subsidies as against transfers have particular distortions. Again, we won't get into the details, but that is one of the elements. So basically, we came to the conclusion that you needed a direct transfer. You needed to take all these subsidies and directly transfer them to identified needy, hungry, poor, needy. And how do you identify them? You have to have some kind of identity. So that is kind of the origin of the unique identity. You have to be able to identify people and say, these are the 100 people who need this money. These are the 100 people who need less or more, and these 100 people don't need. So you have to be able to identify people uniquely to be able to make sure that every single person gets what is due to him. And of course, we will go through the history, which is very important of this element. So now let me jump from the evolution, and I'll come back to the evolution later, to the future, right? We said, what is the welfare system which is our vision? So what is our vision? So first, I'm going to outline very briefly the vision. Then I'm going to go back and review some of how we got there, and then again kind of summarize and give a little more detail. So what are the elements of this vision of the Indian welfare system or Atmanirbhar welfare which we have? there are four elements. A is what I call a welfare stack and an integrated smart card. Now, this is welfare stack is a web-enabled database and programs and recipient, and the integrated smart cards is a proof of entitlement. So we'll go into the details of this, but let me just stick these in your mind that these are the four main elements, and I will go and explain some of the details of this in the next few slides. So we need a welfare stack and an integrated smart card system. This is a web-enabled database which has programs and recipients on it, but is visible to the public, so they can go and check. Each person who has entitlement can check, etc. And the proof of entitlement, where the ISC comes in, the integrated smart card. The second element is the direct cash transfer. We've already mentioned it, but the key here, which I see in the future, is it has to be mobile cell based. Again, you will see how the idea has evolved. When I initially thought of it, there were no mobiles, and you see how the link between how the technology changed, how the environment changed, what things became possible, and how I adapted these ideas to the current situation. So the key element, this direct cash transfer, is critical in my view to a future Atmanirbhar system. And I call B2 is a slightly advanced version, which I will mention, maybe not go into too much details, but I call it the integrated tax and transfer system, where we have a digital tax system and a digitized transfer system of the kind we just mentioned, and we merge them together so it's seamless. Okay, so integrate the taxation and the transfer. If you think of it, there's I mean, it's kind of humorous. I don't believe in communism or socialism, but I think Marx or Engels said to each, from each according to his ability, to each according to his need. In my view, this integrated tax transfer system would be an Indian version, which I feel, which is more enlightened than the communists. The communists were very hateful of everybody who earned more money. There should be no hate. It should be rational system. Okay, so that is the second element. The third part is what can be called equality of opportunity. We must ensure that everybody, wherever he is, in the country or whatever his state, must have the same opportunity to progress. So this is linked to the economic concept of public and quasi-public goods. And I won't again get into the technical details, but this has two important elements. One is public health. I'm sure everybody has become aware of epidemics and communicable diseases during this COVID, but it's much more than that. I think there is still a lack of real understanding of public health. This is by public, I don't mean government provided health, but public health is a technical term in economics. And second is the quality of government schools. Earlier they were thinking that PPP or some version of private and public could replace this system. I now believe that improvement in the quality of the government system. We've had primary schools, secondary schools, primary health centers, secondary health centers, right from day one, from independence, right in the 1950s, all these were set up. So they're all there. Some people talk as if this don't exist, something new. No, the problem is quality. So we will address that and finally, it's what I call in India Vision 2050, what I call a community-based system. We need ground level NGOs with PPP. PPP meaning because some of the finances or much of the finances has still to come from state government, panchayat, perhaps even central government. But these are not broad problems, like poor or farmers. These are very detailed problems. Somebody is disabled, somebody is mentally weak, somebody is an orphan. These are small micro problems which can only be addressed at the community level with the government helping and providing finances, but even well-minded people have to be there. It requires humanity. These are not things solved by bureaucracy or money. So these are the four elements of the welfare system I envision. Okay. Now, in this next slide, what I'm going to try and do is to do a little bit of linkage. How did this come about? when you just look at a proposal, you say, you pulled them out of the air. No, there's a lot of work and analysis and information and data which has gone into developing these ideas. So let me give a flavor of some of them. So what about the welfare stack? Where did that idea come from? Web-enabled database with all central and state government schemes. Well, there was a paper on public accountability information system, PACE, where, and some more detail I'll give you in the subsequent slides, but just go quickly through it, which proposed a national identity card at that time, and then before that, a debit and food card for food. Now, these sounds like a private sector thing, but the basic idea was to use the systems available in the country to provide each person with a unique identity and be able to give them credit which they could use to buy these things, whether it's food or any other thing. Then there was the integrated smart card system. And again, we'll give you a little more detail later, but it could be food, it could be other subsidies in principle. And then the unique ID, which again, we will talk a little bit more, which evolved into the Aadhaar card finally. And this third element, which is, or the second background, which is very important, is the mobile-based payments and receipt system. So what is it? See, before NEP 2003, in which I was also had some role in defining some of the elements of it, the mobile telephony did not exist. Towards the end of this talk, I'll give you how it has come, but it's there was no possibility of using a mobile payment system or mobile wallets. In fact, after I came to this conclusion, again, I'll give you a little more, it took RBI 5 years to implement these. The other precursors of this were bank account universalization and payment apps. This you're familiar with because they are more recent. Jan Dhan accounts, UPI, web enabled. All this became feasible because of mobile telephony, which also means you can give access to people who don't have it. Otherwise, every time you need money, you want to deposit money or substitute money, you depend on the bank. Or if bank has correspondence, if he comes to your village. But this mobile telephony is a revolution. And basically it can tremendously, again, people talk about it, there is the jam trinity, but I do not think people still understand that this is futuristic. To give rural women, rural persons, migrants, women in the hand. They can get the money in their hand, spend it from their hand. They don't have to go anywhere. They don't even go, of course, they are free to go if they can, but it costs money. In a village, the bank may be 2 miles away, 10 miles away. One of my drivers or a driver who's from Rajasthan says his bank is like 10, 20 miles away. It's costly, but this is power. This is power in your hand. So this mobile revolution has played a very important role. Okay, the other few elements of this welfare system. Public goods, I mentioned to you the equality of opportunity. Public goods and quasi-public. Public health is very important and it's going to be increasingly important. The whole world is talking about now communicable diseases are not just regional. They are not just in part of a country or a country. They are global. So we need an institution. One of the weaknesses which was there and is still there, just to give you a kind of example from outside, we handled the global financial crisis very well. Why? Because we had institutions for dealing with finance. Very good, solid institutions. We have never developed a public health institution for epidemic control. I'm not criticizing or praising any government or something. See, long-term development depends on institutions, okay? And so we've not had a very solid, we need to develop a solid institution for epidemic control. What does that mean? It means detection, monitoring, knowledge accumulation. Like pandemic, it was a completely new virus. It took us time to figure out, everybody in the world. But if you had an institution which was constantly focused on identifying, on finding out the best knowledge across the world on how to deal with it and putting it all together and spreading this information, etc., finding the treatments, recommending treatments, you would have seen a big difference. Okay, so institutions are important. And communicable diseases, vaccination, again, because everything had to be decided on the fly. Again, I'm not criticizing or praising anybody, But if you have institutions which are used to dealing with it, then it's likely to be much smoother and much more successful. And the third element, which is again very neglected till Jal Jeevan and Swachh Bharat. I mean, it's been talked about for 20 years, but clean drinking water, sanitation, drainage, sewage, that has again much more importance for welfare of the public than still many people realize. I'll go a little deeper into it later. And then, so public health, and then the quality. We've had these schools for ages, I have discussed government schools, reform, etc., teachers, for I don't know how many decades. But so what is the issue? The issue is we've had this primary, second school, health center, but there used to be 40%, the average absenteeism of the people who are supposed to teach or provide the health, the nurses, doctors, was 40%. I understand from the latest that it's now 25-30% for education at least. I'm not sure what the latest data on the health, rural health centers is, but I would suspect it is also between 25 and 33%, a quarter to a third still. So what is needed to be done? I'll mention a thing and maybe come back to elaborate a little bit. So empower the teachers, students, nurses, and patients through e-learning, e-lectures, e-experiments. I've been seeing on Twitter, people have been posting some fantastic experiments. I can't imagine even my school, which was a private school in Delhi or the best urban centers with the best quality of teachers, this kind of experimental material being actually shown. I still remember in Delhi school where we did physics, we had ancient equipment. We had, which, the West stopped using like 10 or 20 years before we were still using. But if you can connect everybody, connectivity on the web, then you can have the latest experiments. You can show them, you can learn. But the teacher is still there. The teacher is a guru. In a way, this is the modern version of guru. The guru collects all this information and then he acts as a channel for distributing this knowledge and this information to his students. Okay, now I'm going to take a break. A lot of heavy stuff I've learned from the experts. So what is my motivation? How did I get so passionate about these things? Well, I'll tell you two small stories. One is a story about hunger in Kalanidhi. It doesn't matter. It's not a question of which place, which state, or etc. But we were having planning. I was in charge of the development policy division, which was also responsible for PDS and therefore for issues like food and hunger, etc. And we were having a meeting, as far as I remember, in Vigyan Bhavan or some big, maybe Vigyan Bhavan didn't exist at that point, but some big hall like that. And all the food secretaries from all over the country were there. And because it was my division's work, so to say, I was kind of active there. So there was a discussion. Somebody mentioned there is all this hunger. We are getting reports in the press about hunger in Kalanidhi. And in the discussion, this fellow, the food secretary from the concerned state, said, "I'm sorry, I can't do anything about it." That really shocked me. I said, okay, poverty programs, anti-poverty programs, we supposedly helping everybody under the sun, SCs, ST, farmers, but we cannot eliminate hunger. I thought that is disgraceful. That is what made me emotional about it. So I tell you that story, it really hit me very hard, and it was no longer just an intellectual economist's pursuit of social welfare. The second one, which was more, so then I started looking and thinking about it. And what I discovered was the second thing, which is amazing. What I learned was that there are something like 250 to 350 central and state government programs in every district. Every district. And you know how the district is run? There's a district collector. He's in charge of all these programs. And, I didn't have to talk to a lot of people to understand, including IAS people and people who had worked in the district, that's impossible. There is no way one district collector can run or even be supervised 250 programs, forget 350. So this was a kind of second shock to me, that you are doing all these programs and yet you have hungry people in parts of the country. there's something fundamentally wrong. Okay, so so what is wrong? Technically, it's called type 1 and type 2 errors, but what does it mean? The problem here we have is there are so many ghost beneficiaries. You have so many programs, nobody knows who is getting what. The beneficiaries don't know, the people running the programs don't know. So I thought, how can we eliminate this? How can we make sure that everybody who deserves and needs something gets it, and those who don't need and shouldn't get don't get it? So two types of problem. That's why they're called type 1 and type 2 problem, but it's very common sense actually. So, so what I'm going to tell you now is going to switch a little bit to a third way of looking at it. I'm going to give you a sense of the entrenched ideology and vested interests. It took 20 years of analysis and policy reform advocacy. And I'm going to give you a flavor of what that is in the next 10 slides, if you'll excuse me, because it's very important. So what was it? What was going on? Okay, and how did we persuade that to these ideas? It's taken 20 years, you'll see from the thing. Okay, so I'm going to start. I'm not going to start with 70 or 79 as Dr. Charan Singh mentioned, but I'm going to start in 99. So I start with this India's policy reform journey from 1999. This is a volume which I brought out. It's called From Poverty to Middle Income. So that was the idea. How can we get there? Poverty to middle income. Poverty to middle income. Reforms for accelerating growth in the 20th century. So growth was the driver, but there are all kinds of other things which I've extracted. So 20 years, okay? So what were the ideas in this and other things? How did we get to the current stage of that, what I told you, the vision? So reforms for accelerating it. I'm just going to highlight a few things. So we were looking at poverty. I've already discussed that, but half the people were poor in the country, 50%, 60%. So the whole focus was on poverty, anti-poverty, okay? Because there were so many poor. You looked anywhere. You looked at farmers, you looked at rural areas, everywhere poverty. So, so we said, okay, well, what is the key? Accelerate economic growth. I've already mentioned this. I want food subsidy. So wastage and inefficiency. I mentioned all these were analyzed and discussed in this reforms for accelerating growth. Improved targeting for PDS. These are quotes I'm giving from that book, focused on the welfare system really. And the negative income tax. This is the foundation of the idea from negative income tax to net income transfer to what I told you, that focus on ITT system, the tax transfer system. So these were ideas which arose in 1999. Obviously, they were developed, they were framed in current terms, etc. And finally, the electronic debit card. At that time, we only had credit cards, okay, but it had come, and recently only in the 90s they came. But the way I looked at credit card is not just credit, which you repay or you're getting credit, but as an identity. Because why do you look at it that way? Because companies can't afford to have everybody cheating. What I told you, type 1, type 2 errors, they can't afford to have somebody with fake credit cards who just uses the money which they have to then pay for. Or the people, if somebody uses my money or I don't get my money back, I'm going to complain. I'm not going to sign up to the credit card. So the basic element which I'm explaining now, why this was so important, was that in a way it took care of the type 1 and type 2 errors. But of course, the idea evolved after that. So, okay. So the next element was, I mentioned to you in the Planning Commission, so this previous paper was written in the Finance Ministry. This one was written in the Planning Commission. So ideas like the food credit debit card, same problem, same issue. Issue is some people are not getting their proper food from PDS, others are fake, okay? So the initial idea was, there was an idea about food stamps, which was tried, which didn't work, okay? And it was tried again after I wrote this paper with associate, and again it didn't work. So the idea of food credit card or debit card came. From there, I moved on to what is highlighted. Just look at the ones highlighted in red, the smart card technology. I thought that, okay, maybe there's a smart card where we can have a smart card, not maybe. Maybe we could put all the programs, not just a food debit card, but a smart card can have, in a sense, multiple cards. It's simple. It's just a technology. So you could have something for food, you could have for education, you could have for health, you could have for farmers, you could have for anybody. So these were the ideas which arose and were presented for thinking. And then another aspect which was touched here is the income transfer system. Remember, I've given you the solution and the focus. Well, this was first mentioned by us in this paper, the income transfer system, as a possibility, not that it was right there. So this is like more than 20 years ago. Okay. Then from a theoretical angle, much more quickly, I don't know how much time I'm using up. Okay, yeah, let me speed up a little bit. So this is a paper called New Development Paradigm, which was published in EPW and several books. It was reproduced. So the key ideas here were public goods and services, the concept of externalities and social welfare. All these three ideas have gone into developing that welfare system. Where is it that the private sector, the companies cannot function, they cannot do their job, there's no competition, there is externality, or it's a public good? These are all economic concepts. If somebody has a question, I'll explain, but they all, and the social welfare. So all these things have to be addressed by government. Another idea, and you can look at this, it's available on our EGROW website, you can download it and read it. But the idea of starvation and chronically hungry, you recall I said this story when I heard, I was incensed, and emotionally upset. So looked at how to, what was the number of hungry at that time when I actually did the analysis, there were 2%. But how to make sure that there is nobody hungry in this country, okay? Then the next line, state focus on accomplish what alone is able to neglect. I already mentioned this. So the state must, the private sector can do many things if it's a competitive. You have to ensure competition, but the state has to do certain things. So the idea was identify, focus, and get your part of the problem solved, which we have not solved for 50 years or something. Smart card system again was mentioned in this new, and identification, authentication, the whole issue. ID, you've got to be able to identify. Let's say just to give you an example, let's say I earn 100 rupees a day. Somebody earns 50 rupees a day. So basically, you've got to make up more of the difference for me, or the person with the 50 rupees who's earning. You've got to give him more to make sure he's above the poverty line. So which means you have to identify. That's a key concept. If I convey to you, I hope it's clear. You have to identify. If you want to make sure nobody is hungry, you don't just distribute food to everybody. You must identify. These are the 10 people who are hungry, and make sure they get what is needed for them to be not hungry. How you do it is another matter, which which is a matter of efficiency, which can be separately discussed. Okay. Then after this, we move forward in 2006. This is a paper specifically on poverty and hunger in India and what is needed to eliminate them. So the key idea was in this first paragraph, which I've extracted, where I calculated, I took 3 of the most important welfare programs of the center, and then I took certain number of welfare programs of the center and states, and showed that both in 93, 94 and in 99, 2000 with explicit numbers, number crunching, that you could take the money you spent on just 3 programs at the center, big programs, or smaller 6 programs, 3 from the center and the states, and eliminate poverty. That means there was enough money being spent that if you were able to identify this, I told you the unique identification is the key. If you could identify them, you could just use this money and eliminate poverty. No alleviation, elimination. Okay. And then the second part, the negative income tax, which first arose in the 99 paper, was reiterated in this as a possibility for the future. And again, the smart card, the identity, photo and biometrics, we analyzed how to make sure, the previous point I just made, that you have to identify the identity, photo, or biometric or information. All these would become feasible through a smart card and later through the UID and Aadhaar, as we have already seen. So smart card, national identity card. So all these ideas were floated in this, in how to implement the calculated theoretical possibility of eliminating poverty. Now we start getting into the implementation. So in the 11th plan, there used to be plans, elaborate process of working groups, steering groups, etc. So I persuaded the advisor, the member. Usually they are members and then they are advisors grouped under these members according to subjects. So I persuaded the member under which this PDS and the development policy advisor, which was me, functioned to set up a working group. So I chaired that group, and again, very briefly, some of the ideas. The integrated smart card system and unique identification number came up in this, is what we proposed in this working group. Unique national level citizens identity number. These are just quotes from various paragraphs. National level unique ID. ISCS, the integrated smart card system to avoid duplication of benefits and beneficiaries. Remember what I said about that, the type 1, type 2 errors and so on, and thereby help correct targeting. Okay. And then after this, so I was afraid that you would have these reports lie in musty corridors, nothing happened. Then I persuaded the member secretary, who is the administrative in charge of the planning commission, Mr. Shah at that time, to set up this process committee. So process is very unusual for the planning commission. Planning commission just gives reports, makes a plan, then other departments used to do it. So I persuaded him that planning commission must take the initiative because it's poverty. We under the excuse you want to call it a poverty or whatever, because food and PDS was under some other department actually. I mean, we were just, planning commission was just advisory, but poverty was actually a topic assigned to the planning commission in a way. So I persuaded him and he set up this process committee. And here are some of the considerations which I had in my mind. Was that the UID I already mentioned, but the idea was to have the widest possible public support. There was fear, and in talking to some of the people who were in poverty, you remember I mentioned vested interest? I mean, out of those people I sampled, there was only one anti-poverty person, an academic, who supported this idea. Everybody else was wary of it or not supporting it. So vested interests are not just people who earn money or lose money, but they can be intellectual vested interests. So unique identification number. So I wanted to make sure it was simple and non-controversial. And as part of that, what we tried to do was to persuade the registrar of companies and the representative of the Home Ministry that they already had this thing. They had been pursuing a citizenship card or a citizenship number, but it had gone nowhere at that point. It had not gone very far. They had been working on it for 10 years. So I wanted to avoid a conflict that, mera ya tera, this thing about I'm in charge, you are in charge type of thing. So what I said was that citizenship could be separated. Even when you could define citizenship, you could have one part, a digit in the unique ID number where you could say whether the person is a citizen or not. Okay? 01 or something like that, right? So make it resident. So that was the idea was nothing beyond this, but to just keep it out of controversies, get the thing done. Otherwise, huge resistance. Everybody resists. Okay. So project report and also practicality. We actually had a consultant who wrote a project report for setting up of the whole UID authority. It was no longer just a theoretical idea. That's why it's called the process committee. It was the implementation, how to implement actually on the ground. So it's recommended setting up of the UID authority with unique ID, etc. I remember long discussions on how many digits the UID should have. I vaguely remember that 9 or 11 is what we settled on at that point in time. And the issue was whether it should be like a regional up to national or what, but those are simple technical details, doesn't matter. But I'm just trying to give you a flavor of how detailed we went into. So what happened after that? So report was submitted in August 2006. Department of Telecom, which was considered to be the appropriate department. Cabinet notes can only be written by the appropriate department. No other department can. For example, only the food department can put up a note on food, not the finance ministry. Finance ministry can only do budget matters or financial matters. So the DIT put up a committed cabinet proposal for setting up a UID authority in late 2006. And an empowered group of ministers was set up in December 2006, and the EGROW resolved the issue in November 2008. So overall, UID took the implementation part, approval part, sorry, took more than 2 years from the date we had submitted our report. And a UID authority was finally constituted. There were various controversies. If somebody is interested, I can go into it. But the important thing that finally in January 2009, as we had recommended in our report, that it be set up under Planning Commission, it was set up in Jan 2009. Of course, I was no longer in the Planning Commission. I was CA in the Finance Ministry. PAYS. Again, PAYS was the precursor of the welfare stack. The key idea which we had then was accessible through the web, digital database of beneficiaries and benefits they have received. And it should be accessible, not just to the public, but also the NGOs, because they were interested in the poor. The poor may not be able to access the web. So we thought of all these things. And web-enabled public information system, converting entitlements into financial right, a virtual credit debit card based on government funds. So we realized by that time, I realized that we generally thought of physical cards, debit card, credit card, smart card, all physical in some sense, right? But the possibility of a virtual card was beginning to come in. So in this paper, I also mentioned the virtual card. Incidentally, this whole report, again, we don't have time, but this report reviewed the entire social welfare system of the government with particular focus on education, health, and similar programs. So if you're interested, you can, again, it's on our website. Okay, so enough of that, how the thing evolved. Briefly and finally, let's go through the final elements of the future. So the public health and child malnutrition is very important. You remember I mentioned the institution, but let me give you an example of a key element which came from the research. Our research on interstate and inter-country analysis of 2007 and 2012. Again, these papers are actually available on our EGROW website. So it was well known at that time that unsanitary environment resulted in diarrhea, and the issue of ORT therapy was very well known, that children get sick, they don't grow, etc. But it was thought only in visible. Diarrhea was visible. You could see that the child was sick. You could see he was not eating. You could see he was famished. He couldn't eat. He threw up. Okay, these are visible things. But what my paper showed was that the so-called child malnutrition, which, well, some of the stuff, other researchers, and I'll tell you what I found. Some of the research which then I investigated and found that child malnutrition, under 5 child malnutrition, was prevalent in both rich and poor. So it didn't seem to be connected with poverty. It was present in urban and rural. Normally you would think rural people are poor, they are all kinds of, they don't have facilities, they don't have good urban facilities or any facilities, so it would be different. No, they found that there are huge pockets of child malnutrition in urban areas. Okay, and so it turned out the urban slums. So they focused and found there was massive malnutrition in the urban slums of Delhi and Mumbai, which is strange because these are migrants from rural areas, presumably people who were too poor in rural areas and came to urban areas to better themselves. Right? So their income and living should be better than their families or counterparts in rural. And no, we found that the child malnutrition, yes, other things were better, but not child malnutrition. The other thing which then in these studies indicated when we went forward, open defecation in rural area. Now, in the normal time when it's hot, defecation doesn't matter, it dries up. But when you have monsoon or you have floods, all that, the viral load, the bacterial load spreads all over. Okay. So what that research showed was that and people didn't believe. So what that was showed was that this was due to unsanitary conditions. What I showed in a series of papers, interstate and cross country, was that unsanitary conditions. So why? So when I looked into the literature, I found something called environmental entropathy, which was investigated in Africa. And what that meant was there is this virus which sits in the guts of children, they get it from that unsanitary environment. It doesn't cause any obvious and visible change, except that they are not able to absorb the nutrition. So it doesn't matter if you keep giving them lots of food, they can't absorb it. There's a disease, it's called environmental entropathy. So chronic inability to absorb nutrition. And it's linked to, obviously, the sanitation condition means sewage, sanitation, unclean drinking water. This was a major reason for child malnutrition. So you had to address it through clean water, etc., which we have already mentioned. You have to do it. You still have to do it. There's still large, our standards of sanitation, sewage, clean water, etc., have to be brought up to upper middle income levels, at least. So that is part of this new welfare system. People don't see how this part of a welfare system, but it's a very, very important part of our Indian welfare system. Mobile telephony, I already mentioned, let me go quickly through it. Landlines were monopolies. In 2003, nobody thought of mobile telephony, but they were beginning to before 2000, let me say. And I'm going to show you some data. So mobiles, as I said, the new telephone policy was a huge advance. Before 2000, the big thing was privatization of public phone booths. Okay, phone booths used to be public. People used to go to a shop and say, "Ki hame phone karne do." The guy used to take 10 rupees to allow you to phone. There were no public booths. So the big innovation before NTP was that public booths were set up, okay, and things like that. So mobiles really came into the picture. Mobiles are competitive. Landline is a monopoly, okay. So you really can't have real privatization. But mobile telephony made competition possible. Completely transformed the system. So this is what we, the ideas, this professional, technical, economic ideas is what I pushed through the NTP, which it largely adopted. All the other details of what was actually going on in the telephone system, many other people knew much more. But the conceptual basis, that mobile telephony can be competitive. And what do you need to do to make that happen? So competitive spectrum auctions were the things I pushed into the NTP, which was actually accepted. Regulation had to be different. TRA had I was later on made a member of TRA, and ideas like network externalities have to be brought in to make sure that there was real competition. Mobile accounts and payments. Again, a small personal story. I first heard of mobile accounts and payments from 2 African countries. Okay, in South Africa, the government started paying pensions through mobile phones and wallets way before us. And I read about it. In Kenya, extensive use of mobile phones for small payments by ordinary people. I said, how can we use this? This is amazing. Okay. And then I started urging the RBI to allow mobile accounts and payment. They took a loan. Right. They eventually agreed. If my memory serves me right, they took 5 years to do what was happening in South Africa, Kenya, etc. When obviously it was happening. I read it in the newspapers. Anyway, it's good. Now RBI has took many years, but rapid progress has been made since then in table 1. And similarly, UID Aadhaar, of course, after 2009, after the cabinet approved, it has gone rapidly. So here are the numbers. It's just to give you a flavor. These are not just words, but if you look at the active mobile, I've given data from 2010. Already by 2010, 67%. Remember, the reforms were implemented in new telecom policy in 2004. So in the 6 years since then, there was rapid progress. Okay, spread of active mobile. It was already up to 67 or 68% in 2010. The UID, that is the second and third column. So Aadhaar, again you see, initially in 2010, the first year, remember the approval in 2009, and the 2 years it took to actually get it going, or 3 years, you can see. So from 2011, after the new UID chairman was appointed, etc., you see the rapid issuance of Aadhaar to 13%, 25, 49. These are percentage of the population. some people have questioned the exact number, so I've given some adjusted numbers here. So let's say in 2020, the official number seemed to say 95, 96, but my guess or adjustment would be about 90%. But still, 90%, over a period of 10 years, it's a huge achievement, okay? And it's the foundation. This Aadhaar, the UID Aadhaar is the foundation for a whole bunch of services, including the welfare system, which I told you. So spread of wireless, smartphones, lagging behind wireless. Not everybody has, but you can see this number. Again, I can't vouch for it completely, but this is the official number, which is more than half. Half the population has now smartphones, okay, which are which can easily take mobile wallets and the whole payment system, which I'm saying of direct cash transfers. And then the last one, internet. Again, this number is not, I wouldn't vouch for it fully, but this is the number we have got, and it's almost matching the smartphones. So, which is possible because smartphones makes internet usage possible. So it's possible, they've converged. You can see that roughly they progressed, the last two columns, smartphones and internet. So they're kind of going together, but 55% is good. Obviously, we want to go further. But in my view, the further is the last line on the right. If you see, we need to have fiber optic connectivity because that will mean that you can go down to, a combination of fiber optics going down to, let's say, the panchayat level, and then maybe last mile using some other 5G or something, and that is not something that a planner like me or an advisor has to decide. That should be on practical ground. We must involve the private sector and use their innovation and capabilities. In fact, I can again give you a story of a couple of youngsters who studied in Stanford and then set up a company which claims, I have not heard of them since then, I heard about them 2-3 years ago. They say that now they have developed protocols and systems that they can use satellites to send data to every part of the country, not just the towers, but out, if you are out in the boondocks, in the rural area, you're out in the zone, in the water, fishermen out in the sea, they can get that data very cheaply, okay? And remember, the payment system is all a data thing. You don't need to see, okay? You don't need to send pictures. You don't need to hear telephony. It's just data. The data has to go. I order something, I make the payment, I get an acknowledgement, etc. It's all a data link, okay? So anyway, you get the idea. Okay, so I'm going to come back and conclude now, okay, to fix the idea in your mind. So what is it? The India Vision 25, there are 3 elements. I'm putting them slightly differently. I've conveyed that to you in a third or fourth different way to fix the ideas, okay? So what is welfare system, multiple welfare programs integrated into a single welfare stack, a web portal for beneficiaries, okay? A virtual smart card. Remember, in my initial papers, etc., I told you about a multi-purpose smart card. At that time, I had not conceived the virtual. What is virtual? It can all be on the web. Now they have the protocols, the secrecy, the safety features, which were not, at least a common person like me or an economist like me were fully aware of. But now you can have a virtual smart card which gives you an entitlement. Every poor person, every beneficiary can have either a physical or a thing which ensures this is my right. Central government or state government of Punjab has announced and says I'm entitled to this. That entitlement can be there. He can demand that entitlement. It's a huge empowerment. That's what I see, an empowered public. You decide. We advisors, the government, the politicians decide what is it that we want to give. But once you've decided and passed it in the legislature, they must be entitled to it. So we should be reasonable. Don't keep throwing. There's discussion. If anybody wants, we can discuss this. A lot of discussion on freebies, etc. But leave that aside. Let's say you're giving reasonable things. Then make sure they get it. Okay. Poverty elimination and female empowerment. I keep, a lot has been done to make bank accounts feasible, put them on the telephone, you can make UPI payments, etc., etc. Good, all very good. I'm not against it. But I still feel mobile wallets, mobile telephony is the best way to empower the rural public, migrants, females. If we had this system in place during the epidemic, you could have seamlessly given money. There were so many negative stories of people leaving Mumbai or Delhi and on the road, etc. They could have had this power in their hands. They could have had the money. They could have gone to the dhaba and shop and paid, and no issue of starvation. They could have gone and got a bus or an auto. It would all be in their hands. Okay? You don't have to go to the ration shop. You can use that money in your hand. Okay? So this empowerment, I think it's huge. And I have often recommended a subsidized or even free phones to the rural poor woman. The amount of empowerment this will give is amazing. Okay, the last part, which may be way into the future, integrated tax transfer system. The important from economists will understand incentive compatible. It minimizes fiscal costs, and it's a safety net not just for the unemployed but partly employed. The system is set up like that. Again, I have published papers under with Bhalla and others on the NET system, but it covers both employed and self-employed. It will be an integrated system, and not, you may think integrated system will be very complicated. No, the information, of course, is complicated, but once you can get that information, it functions very smoothly and simply. So simple DTC will expand. We've heard of auto seeding. It's a great boon. I think for the first time, my CA has used that auto seeding return to file my income tax return. But if you simplify the DTC, which is a reform I've been recommending for ages, since 2009 actually, that this auto seeding will be available even to a wider set of people. Okay, not simple people. I have no business income, etc. It's all simple, and many of you also have. But it could be wider and much smoother and effective. Poverty, pandemic poverty. You heard of our paper, which Bhalla, Basin and Virmani, and we've shown that absolute poverty has been eliminated. I'll show you the graph again. And the LMIC, the $3.2, which I call lower middle income poverty, is about 25 to 30%. Okay, and this is the graph. So this is the absolute poverty, which is more or less zero here. These are the graphs without taking account of any subsidies or transfers. Okay, any in-kind subsidies. Okay, so once you add food, etc., to this is zero almost. But I'm not doing that right now because I'm focusing on this red line, which is the $3.2 or the LMIC, that called lower middle income poverty. So now the objective would be this, and the way you would do it, this thing, is by combining the existing welfare subsidies, excluding food, education, and health, which I'll say a little bit more about, into an integrated, need-based direct cash transfer system. I think by now I've given you enough information to see what that means. Okay. Subsidies, people will say, oh, you want to eliminate all of the subsidies? No. Subsidies for provision of food, which is food through the PDS or other mechanisms, basic education, job skills, basic health will continue. I don't plan to touch them. I plan to make them more efficient. A plan meaning I see the future. I have nobody to do any of this, but I see a future in which this will be efficiently delivered and higher quality. And it can be done, as I've tried to convey to you. And finally, this NGO PPP program for special needs and especially vulnerable groups. These are the ones which rend your heart, orphans, female minors, disabled, mentally challenged, kids with, few small groups of people, but you have to have special facilities, and you need humane people. If you give it to a bureaucracy, they teach them like statistics. You need humaneness. That is the most, it's not the money. It's the humaneness, the feeling, okay? That if there's a mentally challenged child, somebody with Down syndrome, you have to be humane. You have to accept, okay, that they make many more mistakes. It's the humanity which is needed, and I feel that only community-based NGOs, etc., who have volunteers who want to do good, we need that. Of course, the money, whole or part or whatever part of the money has to come from central state government, panchayats, nagar palikas, whatever, and private donations. Okay, so this is the second element. And finally, the public health system. I've talked about it. I don't want to go epidemic vaccination. I've mentioned empowering users. This is the part which I didn't get into too much. So critical is the 24/7 rural connectivity through PPP. The government already has programs. They've been slow to do. I think they are recognizing it, but a lot more needs to be done. In my view, this is a fundamental foundation of an Indian or Atmanirbhar welfare system, the connectivity. Okay, so private installation and maintenance. Professor Dr. Charan Singh rightly raised the issue. Will government school have the ability to maintain? Well, you don't need to. You empower. This is perfectly competitive. You can have private installation and maintenance. You could have people in villages who are trained to do this. It doesn't require too much training. Lots of people, youngsters competing to provide this service. Government learning and teaching material for teachers. I said e-learning. It's not a question of, there are lots of studies which show that teachers are critical to young students. I agree. I don't expect these to be replaced, but they have to be supplemented. You cannot raise the quality. When 66% of the people are in rural areas, you cannot supply every school. You can't have schools with 10 people and 10 teachers. You got to have a minimum, and we had a talk last week which showed that you can reorganize these schools so no school has more than 30 student teacher ratio or more than 30, and many could have 25. Okay, but still with 25, how many teachers you can have? You have, so teacher is more like a guru. You have to have this guru with access, internet access to the best quality of teaching material, digital libraries, special lectures. They can then decide what to show their students, how to make them understand. Okay, so it's not just a question of connecting the students, it's also connect the teachers. Similarly, health centers actually, the feasibility is more, because there is no study showing that the teacher studies show that teacher is critical for learning among youngsters. But consultation for doctors, nurses, patients. There are many diseases that if I have a cold, okay, or I got a little boil on the thing, many things can be treated over on the internet. You can send a picture. I've come across people in the last year or so who've been asked, they take a photograph. They have a rash. They take a photograph and send it, and the guy, the consultant on the other end of the line, tell them what medicine to use. Okay, and if you're in an urban area, you can go out and buy it. In a rural area, you can order it for delivery. Okay, again, we are talking about the future system here. Okay, not today's system. So consultation over internet. So this internet remote testing and diagnosis is feasible. All non-surgical treatments and oral drug delivery. Surgical treatments will still have to be done physically for obvious reasons. Right? You cannot do surgery. That's all nonsense. The AI will not come for 30 years, 50 years. I don't know how long. So surgery will still have to be done physically somehow. You could have movable bands, etc. Okay, well, that's the last. I've given a lot of material and taken a lot of time, but I hope you got something out of it. With that, Charan, let me hand it back to you. I guess I should discontinue this. So there are some references here which you can, but you can always go on the EGROW website and find many of the things which I've referred to.
Thank you very much. This was very useful. Once again, putting it on record, the efforts that you have made. Plus, we all now know what is the background to the Aadhaar card and the seeding that took place, as well as the welfare measures that the government has announced. We're also thankful to you for sharing with us the vision 2050. That's very useful for us. Now, you have been in the thick of things, and before I open it up for question answers, I just wanted to know your view on the universal income scheme. If when you were in the government, what was your view? Because it's another very welfare oriented scheme. The other is the old age pension, which was again, now that you have the Aadhaar card and you keep speaking about the direct benefit transfers, but then there is the most vulnerable segment of the society, which is the elderly. I don't know if you had at that time when you were at the thick of things, the old age pension. What was the thought? Now, there's another one. I do not know if you would like to, but there's been a Supreme Court judgment yesterday where the issue has been raised on the difference between subsidies as well as the announcements before that. So now that you had thought about UID, and you also knew about who the needy people are, the vulnerable people are, as you mentioned about the hunger story. So what would be your thought on subsidies being given under the Food Security Act to nearly 66% of the population, or 80 crore people? Now, once you can laser beam through UID, should that be revisited? So with these three questions, once we have your response, I will go over to Ashok Vishandas and Dr. Ratan Chand there in the audience, and then we'll open it up to the general audience.
Thank you, Charan. Very good questions, especially the universal income. I was hoping I didn't talk to you before, but I'm hoping you'll ask that. This is why I emphasize Atmanirbhar. You know, what is the source? I don't want to waste too much time on the West, but where are they coming from? They are coming from a situation in the US, which was income distribution was reasonable up to the 1980s and improving. And then it has dramatically declined since the 80s. So they have their very own peculiar problems. What I have tried to convey to you is we have to develop on the basis of our own experience and own development. I don't want to be rude to anybody, but many people, not necessarily all, who have taken this concept from the West and just say it, I am not sure they really understand what systems we have here, what we have. So what the ultimate objective is what I called, I told you, the integrated tax transfer system, whose earlier avatars were net income transfers or negative income tax. Okay, the two papers, blogs we have, Bala and I, on this issue. So what the concept is that we cannot afford, you know, they have a different problem. They can afford to say, okay, we will just give this to people. There's a system of law. There is a system of compliance of taxes, which is far superior to us. If you listen to the talk, I have talked about leakages, evasion. We haven't talked about tax evasion because that's not the subject, but people who have heard my earlier talks know that. We are talking about a completely different environment, okay? So what I have suggested is that what we need is first this direct cash transfer as far as the transfer system is concerned, which is based on the information we have collected already. The ration card has information. The one ration, one nation, one ration. Many other programs are based on information about how much assets different people have. So we got to integrate all this data, and we can define, recall the smart card or the matrix, which we were talking about, the stack, right? All this information can be put a thing, and you can calculate. You know, for example, they don't have any issue of SC/ST. We could have a system which says that, okay, if you are an SC or an ST actually is doubly handicapped. So you could say, okay, everybody else with the same income will get X amount, but if you're an ST, you'll get a little more, 10% more. You know, we have the systems for that. The Western concept is not very useful for us. They should study that's part of the reason for my talk. You know, people who do this, if they want to improve the welfare system, they should read some of those articles. So what I'm saying is that it's Indian suitable. It's not, the concept is coming from outside. It is not based on Indian conditions. The Indian conditions are now very suitable for these four elements which I have told you. There they don't even talk about sanitation. You know, to them you talk about, oh, sanitation, it's obvious. But what do we have? We have 30% malnutrition. Okay, so these elements of the welfare system, all four, how many you want to count, are important for us. It is not just a question of universal income. It makes no sense in my view, frankly. When I first said this, they started adapting it. We cannot afford it fiscally. We cannot, but that's the whole way. That's the reason why one has designed this integrated tax transfer system, to take account of all these issues, okay, and minimize the fiscal cost. So that is one. The second one, you said FSA. That's a very good question related to the poverty calculations and all that. So currently, rural, urban poor, 50% of the urban and roughly 75% of rural get this food subsidy under the Food Security Acts, which comes to an average of roughly 2/3. This system served us very well in the pandemic. So you will notice in my summary, I have kept this food, and I've been saying this for some time, that we need to keep this system for emergencies like the pandemic. I think everything else, the normal transfers, subsidies, etc., can be reduced more or less to those four things, except for the three exceptions. Everything can be put into a single direct cash transfer, which accounts for all the issues you want to account for, rationally. Okay, but I think moving forward, when we are moving to an issue of lower middle income poverty, then I think this number should be reduced. I think government should, once it starts focusing on lower middle income poverty, that $3.2 poverty line, they should also simultaneously think of reducing these numbers, okay, to I don't know, 25, 50 or whatever, I don't think that in future, even future pandemics, remember what I said about migrants, once you're able to deliver cash in the hands, in some ways that's much more important. Let's say you have a flood, that local food price shop is wiped out, it's not there, okay? Who are you going to go to, okay? If you can just save your cell phone, that's all you need, your ID. The virtual ID and entitlement will be on your cell. In fact, it should be on the web also. But anyway, if you can just escape with your life and your phone, you can go somewhere else and immediately get relief. Okay, so I think that future system, one should, in the light of all that, some reduction and use for this integrated transfer will be called for. Just on the aside, I don't know how much time you want me to spend on your other two questions, but in a sense, old age pension is already into the DBT system. So in some sense, it's already part of the cash transfer system. And you think of aged people who, they would get the money which will raise them above poverty line. That will be part of that direct cash transfer system. So I don't think there would be a reduction. In fact, they may actually get a little more, which would be quite happy. In fact, if you deliberately wanted, that could also be put in the system. Remember, that's the beauty of the UID, the unique ID. That's why I still prefer to call it unique, because it's the uniqueness. You could say these 100 people or these 3 people in this village are aged. They don't have any support. Let's give them X amount of money. You can do it. Once you have the system in place, you have a unique identity for every person who needs help. That's the key. Okay, we don't need the exact identity of PIL lawyers or wealthy NGOs. Okay, but we need the identity of all those people who need help. If a guy is hungry, we should be able to identify and make sure he's no longer hungry. So same goes for the aged. Freebies, my simple answer, we can explore further if there are other questions, but the simple answer is that exemption. Remember, I said I prefer everything to go in a cash transfer except for 3 sets of issues: food through the PDS, education through government schools, and certain type, and public health and certain elements of the health system. Rest of it, and the third part, the important one, is the special needs. By the way, which aged is included there, if you recall in the last slide. The aged and the orphans, etc., obviously need a special type of help. So those 3 elements, okay, will remain. Rest are freebies. So if farmers need income, give them income support. Nobody is saying don't give farmers income support. But anything else which is a subsidy is a freebie. But remember, again, don't want to get into production subsidies. It's a separate issue. I'm talking about money going to people, individuals, household. Production part we can discuss separately. Here in this talk, we are talking about money subsidies going directly to individuals and households. Okay, so next.
Let me open the house to questions, but first I would like to go to Dr. Vishendas.
Thank you, Mr. Chairman, sir, and thank you, Professor Charan. Sir, it was a wonderful exposition, and we got so many insights, and thanks for sharing your thoughts with us. Sir, I have few questions. Sir, it always worries me. On one hand, MG Narega provides a lot of employment under at least 100 days, and almost about 10 crore people are registered for MG Narega. On one hand, it gives about 250 rupees a day for 100 days. On the other hand, sir, they continue to earn only that low level. So what is your thought of upskilling the skills of the unskilled person, because they cannot work on this? There is a context to this. When I was in the agriculture ministry, CACP, sir, we did a survey in Gujarat, and the agriculture labor were hard to find. And then we found that many diamond polishers, they trained them for about 2 to 3 weeks, and their wage rate increased 4 to 5 times. So that is one way. So that therefore I underscore upscaling the skills of the unskilled worker. Second point, sir, the women's participation in India is one of lowest in comparable countries. And third point, sir, the number of billionaires in India in recent past has increased to 155 in 2021, and they account for 19.6% of the GDP. And that also shows the inequality is increasing because a significant wealth of the nation is concentrated in few hands. And sir, my fourth point will be.
Sorry, I didn't get that. Number of weavers, number of who?
No, billionaires.
Billionaires. Okay.
Yes, sir. There are 155.
Okay. Next point. Yeah.
Sir, last point, sir. The agriculture engages about 43% of the workforce, yet they contribute only 19% of GVA. And implicit in that is the agriculture labor productivity is about 29% compared to that of non-agriculture sector. So how you improve the agriculture labor productivity? Thank you, sir.
Okay, lots of questions, which is fine. I think, yeah. So let me first take the first one and just tell you the link to welfare, then I'll come to the broader issues. I think, yeah, a lot of people are interested in the broader issues. We can take that up. That's fine. So what is the link to the TT? What I said, the integrated tax transfer system will actually take care of this problem, because whether you are self-employed, you have to, there'll be a system for declaring your income, and based on that, you will get an amount. You mentioned it also connects Charan Singh. I forget the exact amount we calculated, but I forget whether, well, we could take the $3.2 a day, for example, line, right? And translate that into how much it means per week, per month, etc., right? And make sure that everybody has that amount. Let's take that as a discussion. So if there is underemployment in the rural areas, then every adult who doesn't come up to 3.2 will be able to claim that amount, as against universal income, where everybody would get that 3.2. So you both make sure everybody has the minimum necessary to live, but also you minimize the amount of fiscal burden. Okay, that's the basic idea of the tax transfer system, and that is exactly what you're saying. It is designed to make sure of self-employment and underemployment. In the West, they only have had till very recently, maybe you are either employed or unemployed. Very simple thing. You are unemployed, you got unemployment insurance. It's a completely different world, as you well know, Dr. Vishendas. Here
Yes,
we
sir.
have these complicated self-employed people, unemployed. So when we get to that tax transfer system integrated, they would all be able to get some due help which society believes is their due in some sense, right? Okay, so that's the connection. Now let's take up the one more issue is connected. So let me address that first, which is the women's participation and thing. So one of the key reasons why I emphasize the internet, the connectivity, is that this will allow women to work from home. And this is a key for rural women. They could sit at home. Once the internet and the web, the thing reaches every village, in principle, more or less, they are working from home. They don't have to leave the village and go to some nearby town or nearby shop or something. In principle, there will be many occupations opening up where they can sit at home and do. Obviously, that does not apply to everybody, but even among men, the participation rate is 50%. So when I'm saying women will be able to, I don't expect every woman 100% will go suddenly, no. But certainly it can rise from 10, 15, 19% to 50%. Many women will be able to work from home in many types of service occupations, etc. Educated. So many of our educated women, even in urban areas, certainly in small towns, sit at home because they can't go and work of anything. They had degrees, they're being wasted. So work from home requires connectivity, and that is another reason why I keep emphasizing the importance of connectivity. Okay, so these are connected somewhat, but let's come to skills and employment. Absolutely 100% correct. We worked on this National Skill Development Corporation. It still hasn't fulfilled its role which we had envisioned at the start. Which is, I'll tell you what one of the problems with skills is. Too many people, when you say skills, they think of highly skilled. Your point is very valid. I'm just going to elaborate from my perspective. So they think of, oh, we need IT skills. We need people who can do AI or robotics. No, there's a whole range of skills. Okay, there is a very low level skills. There is intermediate skills. There are different levels of skills. All these produce jobs. A simple 2 or 3 points I often make is that the plumber may be able to tighten a thing or something, but let's say he has to make a cutting. You'll bang the thing. There are tools. Skill means you could have these simple tools, okay, which you can make a neat cut and join things. These are all little middle level skills. I mean, diamond cutting is probably a little more more middle level skill, but there's a whole range of skills which need people. There are these factories near my home where they try to give all kinds of coaching. I mean, people need coaching to be able to communicate. Not everybody can communicate, whether it's in Hindi or English. You have to be precise. You have to be able to get to the other person. You can't just speak as if you're sitting in a dhaba. So all these are little skills you need, which you can improve your productivity and your wages. Absolutely 100% right. You're right to emphasize that we need to make sure, rather than thinking of an urban Narega, think of skilling. Can you skill the urban population? Can you skill the rural population so they have job skills, things which will actually be useful to an employer if he thinks of hiring you? So that is very important. I'm glad you raised it. It's just a way to emphasize this issue. So which will be very important for productivity and wages. I mean, you and I, when we talk about employment, we are not just going and saying that digging ditches. We want productive employment. For that you need skills so that you get the compensate wage, right, and income, right. So agriculture and labor workers. So we have discussed this is a complicated issue. I mean, the whole development of the economy. I've recently read a comparison of labor-intensive exports. Okay, a shocking number that compared to China, just labor-intensive exports. China has 30% world share. India has 2.5. Why is that? Long story. But what I have tweeted recently, and again we can go into it. But I mentioned what I mentioned in my earlier talks, which you have heard. is that you need, you think of labor laws, everybody knows. Great policy reform, but you need to translate into rules, regulations, procedures on the ground so that the business can start using these new laws. The labor can start using. One. Two, we don't realize that direct tax code has an effect on the labor intensive MSME sector. The GST, the more complicated it is, the more it benefits the corporate relative to the MSMEs, or vice versa. The simpler it is, MSMEs benefit. Level playing field. Direct tax code, GST, customs duties. The big companies, exporters, importers have systems. They have programs. They have no problem. One small exporter, importer, the poor fellow, going through all the customs, simplify them. Customs laws, they make a lot of difference. So there are several things. Of course, infrastructure everybody has talked about, but let's not spend. I think the idea is correct, and we need to do more about it to make agricultural exports. I talk generally about MSMEs, but it also applies to agriculture. You have a son of an agriculture. Is he a farmer or is he an exporter? He can choose. If you make it simple enough for him, he'll become an exporter. He can export farm produce from his village, from other villages. He can do all kinds of things. He can generate specialized fruit. You talked about this in your talk, but the export part is an obvious and simple thing which we know what the huge gap there is. Even if we close from 2.5 to, if we double our share in labor intensive exports, which includes agriculture, there would be a big transformation in the employment scene. Okay, I think, Charan, we've taken, I may take up the one other question later, but let's see if there's.
Yeah, anyone wants to ask another question, please raise your hand. I don't know if Dr. Ratan Chand wants to ask a question. Dr. Ratan?
Yes. So good afternoon, sir. This
Good
is a very
afternoon.
nice lecture. In fact, it's just an observation regarding identification of the beneficiaries. You see, most of the beneficiaries of the Ministry of Rural Development schemes, they are being identified through the socioeconomic caste census, which was conducted in 2011. So in between, how that is being updated, that list of eligible beneficiaries updated, or some of them might have gone above the poverty line. So all this updating is not taking place. And as you know, this 2011 census and the national population register, which could have served the purpose for identifying the beneficiary, that has also not been taken place so far. So this is a big task. That is my observation. Similarly, when I visited some of the rural areas, for example, this national old age pension scheme. So that is also very manual type of thing. That is based on perhaps 2001 census. So it is very rudimentary type of thing. How they are updating that list, and some people are dying, and how they are taking care whether pension is stopped, those who has died. So it's a very the information systems have to be, I think, made efficient or efficiently implementing the schemes. That is just an observation.
Yeah, thank you. No, that's a very important point, which actually is directly related to what we are talking about, and I'm glad you pointed it out, because I can only I highlighted certain elements, but this is absolutely vital for the data part of it. Unless we have the correct information, it would be kind of fooling ourselves to think all those leakages, etc., have gone. Clearly, you're very right that if we are going to give people benefits based on age, etc., then we must have updated information on that. And that is something which must be taken account of and should not be neglected. Thank you. By the way, Ashok, sorry, there's Gayatri, who's raising Ms. Karnam, but just very briefly on one other point by Dr. Vishandas, which was on inequality. The only point I quickly want to make is there a lot of confusion. I'm not saying that Dr. Vishandas makes that, but there's a lot of confusion in the media, especially TV, between three types of inequality: consumption inequality, income inequality, and wealth inequality. I have seen that even the best organizations, so-called well-known organizations, no point naming them here, in the West, in UK, etc., they conveniently mix these things to make different points without trying to be very honest. They will use data on wealth inequality to make points about income inequality. Somebody will use consumption for income and income for consumption. It's very important to keep the different types of inequality separate when we are talking about policy. When you're just having a debate and arguing and having fun on TV, that's a different matter. But if you're going to use this data to define policy, one must be very precise. So that is one thing I would tell all our listeners, that don't confuse these three types of things and draw wrong policy conclusions, because that will cost us a lot. We've wasted a lot of money over the last 50 years because we are not fact-based, data-based analysis, research-based policy making. Okay, so Sharon, I see a hand here. You maybe see it.
Yes, I would invite Karnan Gayatri. Is that Miss Karnam Gayatri?
Yes,
Yeah,
yes.
please go ahead.
Good evening, and I'm really very, very thankful to Dr. Virmani for raising very, very important policy concerns. And our own policy research has shown, I completely agree with Dr. Rathan Chand that the base that we are using, 2011 census, and it really doesn't help us identify the right clientele for our benefits to be disbursed. Also, there are approaches like, we usually use separate targets and achievements and then try to see the overall target and achievement. As a result of that, we have had cases where there is excessive provisioning of certain services like social housing as such in Karnataka. We have seen that there is excessive housing provided in certain districts than the required number as such. The first problem was we do not have an adequate assessment of the required numbers. In this case, these are problems which are known to all of us, type 1, type 2, but I basically wanted to sort of refer to this particular practice since you refer to many of these advanced techniques that can be used in delivering services as such. We have come across the practice in South Korea, a government which has almost 40% of its budget going towards welfare schemes. They have a real-time assessment of the needy. And we are talking so much about improvement in technology and things like that. Why can't we really set right this? Because as we all know, we have reached a stage where a lot has to be done on the expenditure side rather than on the tax front. Yes, there's no doubt we need to really work on tax front also, but I think there is a lot of scope in bringing about fiscal savings on the expenditure front. If at all some of these duplication, some of these type 1, type 2 errors are addressed and right needy people are provided with the services. So I just wanted to flag this issue, just refer to the group that there are practices which are available outside. I don't think we need to really reinvent the wheel by sort of, conceiving new ways of providing these services. This just to sort of provide some.
Right. So thank you. That's another very important point in addition to the earlier ones. Let me tell you, in my last few years in Planning Commission, I was also heading the project evaluation division, and I initiated certain reforms in the Planning Commission project evaluation. So I have this unpleasant habit that I headed the water division for 2 years, because 2 months, because the fellow had left, nobody else could take over. So I took the charge of that, and I initiated some reform which probably died. But same thing probably happened in the project evaluation division, Now, of course, there is no such thing in the plan, the new key, as far as I know. There was some talk that there is some project evaluation. I don't know. I'm not totally updated on it. In fact, yeah, a few weeks ago, somebody mentioned. So, but yes, absolutely. I mean, project evaluation, if you're going to have 100 programs, 150, even 250, I mean, I mentioned 250 to 350, you really can't have so many programs without having evaluation. But one of the things which I suggested in my review of social program was that we should group them under 3 or 4 heads. I mean, there's really no, it's useless. I mean, you don't need, a big thinker or thinking or practical experience to know that you cannot run 250 programs at the district level. So, I mean, it could seem to be common sense that you should have maybe 5 sector programs, or 3 to 5 sector programs in each district by broad heads. I mean, I mentioned some, you may have better people like you who work on the ground, including Dr. Ratan and others. But within those, which thing to focus on is really should be decided at the lowest levels, at the panchayat level or the Nagar Palika level. They know what is the most important within that head. Okay. I mean, just having 250 programs announced, given down by the center or even the state, is, I'm sorry to use this word, to me, it's crazy. I mean, it's just that there's no way. I mean, I don't know who expects to be successful. So what was the solution? They used to have these waves of programs. 1 year or 3 years, everybody is working on these 2 programs. Okay. Next year, new government comes, everybody is working on these 3 programs. I think that's not the way to do social welfare. So anyway, but you're still right that concurrent evaluation was a word coined, I don't know how many, 20, 30 years ago. Dr. Charan Singh worked in the project evaluation division or evaluation division of the IMF for a long time. Maybe he can add something. But yeah, knowledge. But let's take a few other questions, Ms. Gayatri, then, or if there is time. Charan?
Sure. I don't know if there are other questions now. Dr. Ratan, did you have another question?
No, this is okay. Thank you.
That's okay. Then we could go to Gayatri if she has a supplementary question.
Okay.
Professor
Thank you
Gayatri.
very much.
Yeah.
Thank you very much. Now that all these important policy questions are raised, I think it's the most appropriate time to look at our own outcome-based budgeting framework that we are using. As all of us know, ultimately, unless we use or frame informed decisions, I mean, like the problem will persist and we are really going to be increasing our expenditure in the long run. So in that particular respect, I think we need to really go back and look at the kind of frameworks that are being used by the governments, be it at the central government level or at the subnational level, the frameworks that we're using for outcome assessment as such. Do we really have the right outcome indicators? You refer to monitoring and evaluation. I'm so happy we did some work way back in, I think 2012 or so. We found India was one of those first countries in 1950s itself. We had independent evaluation office and all that. What has happened to all this? And do we really evaluate most of the major programs at least? And do we really have the right outcome indicators? And if we have the indicators, do we have the data? If we have the data, do we really peruse it in our budget decision making? I think these are the core policy questions that we need to really ponder over. I thought I'll flag some more issues and then I'll be happy to get
Sure. So I think those are all useful points for everybody. Yeah. So again, I would kind of just say that one of the conclusions that I came to in my 2006 evaluation, that paper which I mentioned, was that these, as you mentioned, I mean, independent evaluation, concurrent evaluation are not new concepts. So what I concluded was the only way to ensure some amount of public accountability was put it on the public domain, which is what that phrase was about. You are quite right. I don't know. I doubt that much has been done about it. Some has been done. There was a spurt of activity in certain departments of putting almost concurrent. I remember a few years ago seeing some states, like I forget the name, but they had almost last week's data that these are the beneficiaries, they are getting this. But the idea of that PACE, public accountability information system, was that if we could force the people who or the departments and states or whatever organization which use public money to presumably provide to beneficiaries must put this on the website. This data must be available. An NGO or local area or an academic like you or think tanker should be able to say, okay, you have said that you have given beneficiary XYZ so much in the money. I go to the village and I find this is not true. So some amount of gradual public, these things don't change like this, but transparency. So that was one of the major, that's why that PACE, public accountability information system. Now, these don't happen magically. We know. I gave you a story of 20 years of struggle against ideology. It's not even pure money interest, ideology and vested interest. So these has huge vested interest. They are making money. So this requires conscious effort. I'm not saying nothing has been done, but apparently from both what Ratan has said and what you have said, madam, that it's obviously not gone far enough. So I accept that, and it's useful that you point this out and inform all of us who are listening that there's a lot to be done here. Okay.
There is one question which I have in mind,
Mhm.
and I was wondering if someone would raise it. And that is, you have raised this issue of malnutrition. You have discussed this at length in your writings. And this global hunger index keeps coming every year and hurts us very badly. Now, would you have a view on that? Because the way you mentioned the entropy, environmental entropy thing, and the malnutrition causing lots of distress and lack of absorption of the child, whatever food you may give him. Now, on the global hunger index, given this, your research, what would be your views, or would you have any suggestions?
So obviously, I mean, the thing to do would be that somebody has to finance an alternative. The question is, would, for example, the government of India or the Department of Child and Welfare Services finance EGROW Foundation to develop a more rational, science-based index? For example, obviously, where we are able to show a link between sanitation and malnutrition, those elements should have more weight, sanitation variables, right? Rather than just doing it from an abstract level and saying, oh, this is the calorie intake. When we know, we have done studies, we have seen studies, we have done studies which show that calorie, again, the same thing is known. I mean, when I investigated 20 years ago, we found that the calorie intake was not linearly from poor to rich. It was all over the place. There were poor people who were overeating. There were rich people who were calorie deficient. So it is not directly linked. So to use a calorie index is just doesn't make sense. It's not backed by scientific studies showing any link between that and something we would call poverty or deprivation or whatever. It's just common sense that you read newspapers and develop indices. I mean, that is not the way. So obviously it takes effort. I mean, to develop an index which is applicable to 100 countries or more countries. So somebody would have to finance it. Yeah. I mean, unless that is done, we can only write articles against global hunger index every time it comes out.
I agree with you. Means I feel that the Prime Minister's program of a toilet in every household probably should show us results now in terms of environmental entropy, and there should be visible, demonstrable data set to show that in this area, how malnutrition has been taken care or child mortality has taken care. So I think this is good, and we in EGROW should put up a proposal and seek some resources to find the correlation between increased number of toilets and negative relationship with
So
the other.
as Miss, yes, absolutely. But as Madam Gayatri pointed out, one has to be a little careful that if you build toilet where there's already one, so it's a coverage you have to look at, not the numbers, right? So if
Right.
you have a second toilet in the same place you had, you won't get much benefit, even though the data will show there are two toilets now. So that little,
Right.
if one is careful, the coverage is the key thing, variable, right?
That's
What
true. It's
percentage
more like a
of
more like a
individuals or
proxy.
households who are covered by toilets, or who are covered by clean water, or who are
Right.
covered by proper sewerage systems rather than open nullies with open drains, right? That kind of thing. Yes, and that kind of careful study requires a certain amount of funding. I mean, this can't just be done.
I agree with you. No, because the Prime Minister did mention about the toilet, and then he also mentioned about Har Nal Jal.
Yeah.
So that water has been taken care. Now
Correct.
the concept of the drainage system and the sewage
Drainage and sewage is not yet covered. Yes.
not yet covered in the Prime Minister's plan. So I think that is one thing. If that gets covered, it should have a direct relationship with environmental entropy.
Yes.
So yeah. So Dr. Virmani, we must thank you for your time today. It's been excellent talk, very participative, and also it has given a historical perspective as well as a very futuristic vision. And as you have seen from the discussion that happened, the way forward is emerging so beautifully. So we thank you for your time. I'm very happy to mention that we'll be putting this talk of today on our website tomorrow. And next Friday, we have Montek Singh Ahluwalia speak to us about the reforms in the past and looking ahead. We will do the same exercise from 4 to 5:30, and we hope you will all join us and take benefit of the time that Montek Ahluwalia will be spending with us. With this, it's already 5:52. Let me close thanking the chairman and the speaker for the day, Dr. Virmani, to have spent at length this time with us, and the participants to have enriched the discussion that we have had today. Thank you very much, and see you next Friday.